Can you see them?
Yes.
Okay. I'll just circle these around for a minute. Dr. Cunningham, feel free to start whenever you're ready.
Thank you. We'll begin in just 1 second. I'm putting the text attendance in the chat box because we've had some requests for that.
Okay. And if anyone has issues with their text attendance, please feel free to direct message me. I'll be on the call for the duration of the program. Just as a brief introduction, my name is Jill Phillips. I'm from the CME office at the IU School of Medicine, and I can help you with your CME credits as well as for social work and psychology. That information will be relayed to IU Health. So if you could go ahead and text your attendance, regardless of your accreditation your degree, please go ahead and do that so that we can make sure everyone receives the appropriate the credits that they're needing for this program. Thank you.
Thank you so much, Jill. Well, let's go ahead and get started. I'd like to welcome everyone today to our session, Caring for Muslim Patients and Families. I am Ann Cottingham. I'm a health services researcher with the IU Health Evans Center for Spiritual and Religious Values in Healthcare. That center is directed by Dr. Lexi Tworky and is co-sponsoring this event today with IU Health Chaplaincy and IU Health Spiritual Care. I'm joined today by my partners in this work, Chaplain William Taylor. Chaplain Taylor is the IU Health Director of Chaplaincy for the Indianapolis suburban region, and also our colleague Gloria Robertson, also of the Evans Center, who will be directing the administrative portions of this program. We're a large group today, So we ask that as you have questions during this panel discussion, please submit those through the chat function, which is at the bottom of your screen. And we will share your questions with our guest panelists. We're fortunate today to have 4 expert panel members to lead our discussion. We are joined by Michael Sahir, Ashaki Rodriguez, Imam Ahmed Alamin, and Ismail Abdul Ali. Thank you so much for joining us. Now I'd like to invite our panel members to each introduce themselves. We will then kick off our session as they share a bit of background about Muslim culture and then move on to specific questions around caring for Muslim patients and families. So let's begin. I'd invite our panelists to go ahead and introduce yourselves, please.
Okay, in any particular order?
Any order you like.
Okay, my name is Michael Sahir, and I am the Imam at the Nur Allah Islamic Center. For years, we've been on 46th Street, but to move east to Bedhalter. I've been the Imam since 1992. I've been involved with clinical care, teaching at community hospital as well, and also done presentations on Muslim care at various hospitals around the city. I'm a retired firefighter from the city of Indianapolis. I've been retired 4 years, and that's pretty much it, I guess.
Thank you.
Yeah, this is Ismail Abdulali, and I am the Imam of Masjid al-Mu'mineen, which is on the northeast side of Indianapolis. I'm also a correctional chaplain for the Indiana Department of Corrections, which I have been doing since the year 2000. And thank you for having me.
Thank you.
My name is Ashaki Rodriguez. I am a member of Nur Allah Islamic Center. I am a registered nurse through IU Health. I've been a nurse for 21 years. And I am excited to be here and have this conversation.
Thank you.
I'm Ahmed Al Amin. I was born and raised in Saudi Arabia, and I started my Islamic education in Saudi Arabia. Earned my master's, bachelor first in Islamic studies and jurisprudence from the Islamic University of Niger, and then my master's in Islamic jurisprudence, finance, and economics from the University of Yarmouk in Kingdom of Jordan, and an MBA here, currently pursuing a master and hopefully a PhD in School of Philanthropy in IUPI. I have been the Imam of Indianapolis Muslim Community Association for the last 4 years. And I also serve as a police chaplain with Indianapolis Metropolitan Police Department and also Marion County Sheriff's Office chaplain as well.
Wonderful. Thank you so much. Again, we appreciate your all being here. And now I would invite you to just, if you would give us a little background on what does it mean to be a Muslim, a little background on the culture and traditions of this spiritual tradition.
Mm-hmm. Yeah, that's a very good question. And I think most would agree with me when you say the Muslim culture within the United States is very much in a state of evolution. We don't have many generations. We have a few generations now, but we don't have hundreds of thousands of years of Islamic culture in America, which is really, I think, a very positive thing because we're growing naturally and into enjoying the Muslim life, learning about the life of Muhammad the Prophet, which is a very key figure in our Muslim life. How do we blend that with the American culture? And if the blending is going quite well in very many arenas, as you see the four of us here, we all come from professional fields that require a engagement and an exchange. And we do it being 100% Muslim. So it's the life of a Muslim in the United States has really been good and very excellent. Of course, there's going to be a challenge, but those challenges have served to make it even more excellent as we continue to strive to go forward. So that's my contribution.
I just wanted to add, Jazakallah, thank you, Imam Mikhail. I would be a little bit careful to call it Islamic culture, because it's important to distinguish, and we have all professionals here. It's important to distinguish between culture and religion in Islam. The religion is universal, it could be applied everywhere, but cultures are different. Within the same country, you have different cultures. So that's why there is nothing we call Islamic culture, more of it is Islamic religion. And that's why throughout the conversation, probably we'll talk about cultural issues. It's very easy for us as imams to speak about the religion, but very hard to talk about culture because, like I said, each country has tons of different cultures. Sometimes within the same region you have different cultures. Uh, while Islam acknowledges cultures and respect cultures, we should be very careful labeling certain culture as Islamic because this could create a lot of confusion in the religion, and also sometimes we mistakenly apply some people's culture on other people's on other people, which it really is not suitable. So you can see two Muslims or three Muslims, each one of them would have different culture. And I think that it's very hard to focus on the culture today for the diversity, and also there is no set of rules that we could follow to explain a certain culture. But we will do our best to explain what are the Islamic perspective. As Muslims, we are obligated to follow the religion, not necessarily the culture. And I also think the expectation from the hospital not to cater necessarily to every single culture, but our job today is to cater to the Muslim patient, if I'm making sense.
Okay. Yes.
Imam, thank you very much, Imam Sahir and Imam Ahmed. I think one important aspect of the Muslim community in the United States and in particular Indianapolis is the absolute diversity of this community. Just as the idea that I represent a convert community that many of us who, especially are African Americans, are converts, either first or second generation. That our children or their parents are converts. Then we have so many people who have come from other ethnic, North Africa, East Africa, West Africa, and they carry different languages and different cultural aspects that you'll find. And I'm in agreement with Imam Ahmed and Imam Mikhail that the religion is the same. It's the same faith. And I would say basically the parameters of the cultural would be basically the same, but because of language differences and some people actually come from Russia who are Muslim that live here, in the Caucasus Mountains who are Muslim that live here. So it is a great diversity, and I think that's one of the great beauties of because this is the most diverse religious community in the country by far.
All right, thank you.
You.
So I would like to, I really appreciate helping us to understand that when we're speaking about Muslims, we are speaking about the faith and adherence to Allah and the Quran. And so could you express or help us to understand, at least since there's such a wide diversity within the Muslim community, whether it be here, Russia, or other parts of the world, what would you say would be the main tenets of Islam? And I think we can narrow it down there to help us as we move forward in our conversation.
Mhm. Okay, well, the main tenets of Islam, that we have five uh, principles. We say there are five pillars, and the first one is that we make a testimony that there's no God but the one God. Now, I do want to clarify, and the other imams that can help me out. When we say Allah, that is Arabic for God, and there are millions of Christians who live in Muslim countries, and they also say Allah because they're speaking their language. But when we say Allah, it means the God, not God, but the God. And if she was speaking Spanish, she may say Dios. So Allah is not just limited to Muslims only. Those who speak the other language in any religion, they will also say Allah. But so the first of our tenets is that we bear witness there's no God but God. And we do say Allah, the God, and Muhammad is the messenger of God. That's the first of our pillars. The second pillar is that we pray 5 times every day, depending upon the time of day. The third pillar is that we give in charity. It is incumbent that we share the wealth that God has given to us. And the wealth is to be shared indiscriminately to those in need. The fourth pillar is we fast, and as many know, it's popular around the month of Ramadan, which is going to begin in about 14, 15 days, I think, give or take. And the fifth pillar is the pilgrimage to Mecca called the Hajj. And those are our 5 pillars. I'm going to let one of the other men speak about our 6 beliefs, if they would.
So, thank you, Imam Mikhail. These are, yes, the 5 pillars of the practical pillars where action is required. But there are other pillars where that relate to faith. And we all understand that faith is in the heart. Religion is practices. So the faith that we have to maintain in the heart has to do with believing in God, the Creator, and believing in His messengers. We have to believe in all the messengers and their messages, and we have to believe in all the holy books. And that's why I tell people from Christian and the Jews that Islam is an extension to these 2 religions. There is an Old Testament, there is a New Testament, then there is a Newer Testament. So the Old Testament was given to Moses, the New Testament was given to Jesus, and the Newer Testament was given to Prophet Muhammad, and peace be upon all of them. And we believe that Islam is an extension to Christianity and Judaism. And that's why when you read the Quran, you will see a lot of similarities. So, and then believing in the angels, that there are angels and they're assigned the specific tasks. But the most relevant to us, especially for end of life care, and so, and especially the patients, the 2 last ones, which is first believing in predestiny, that God has predestined everything. We do our best, we work hard, but at the end we have to accept the will of God. And you cannot be Muslim if you question God, right? So, and I find this very helpful to me as a chaplain, even when I deal with people from different faith, that we accept God's will, and this is one of the pillars of our faith. And the last one is believing in the day of judgment. So this does give comfort to the families when we tell them that, you know, your loved one is not perishing, your loved one is moving from one life to another life, and which we call the life of judgment, where God will actually question everyone and then, you know, decide who will go to the paradise and hell. So this is not our discussion today, but believing that there is another life after this life is essential pillar to in Islam, which is actually very helpful for the healthcare professional and specifically the chaplains. So it's a very fine to tell the family, you know, who's grieving that, you know, hey, you know, you have to accept the will of Allah or God. You know, this is His choice and this is the right time. You know, we cannot, you know, challenge His decision. Uh, that's, I think I will let Imam Ismail to add.
Mhm.
Imam Ismail, are you here?
Mhm.
Yeah, I'm right here. Well, and you know that we talked about the 5 pillars in our what we call the cardinal articles of the faith. Yeah, you know, I think the most distinguishing characteristic of our faith is the prayer. It's the what we call salah, and that is something that we must do 5 times daily at appointed times. It is a structured and scripted prayer that you know, that we must make certain movements, and that physical movement where the culmination of that is the prostration, where a person places his head on the ground, where his heart is higher than his brain at that time. That it is a prayer that is most likely, and you know, that we like to do mostly in congregation as a group. You know, that if there's 2 people in the room and it comes prayer time, they want to pray together. You know, they want to pray together, and they are able to pray anywhere, right? You know, one of the gifts of the prophet, peace be upon him, was that the whole earth was made pure for us to pray. So we don't need any particular place to pray. We pray wherever we are that's clean and quiet, and you know, that we're not obstructing other people. But that being you know, the distinguishing characteristic, which includes a purification, that people must purify themselves actually physically with water. If there's no water available, then, you know, some other means to have a ritual purification. But you know, that sometimes you'll find that, you know, because one of the parts of is washing the feet, and you know, you'll find that, you know, sometimes Muslims have a tendency to leave a little water on the floor, the little water places, because of that that purification that we do. So you know, and then, you know, the places that are, you know, we look for places where we're able to make that purification, to make that what we call wudu, the ablution. And you know, that's something that maybe, you know, the accommodation for that. You know, I remember as an enthusiastic new Muslim, as extremely enthusiastic new Muslim, that I wash my feet anywhere and put my feet in the sink anywhere. And you know, people just are not accustomed to a man putting his feet in the sink. And there was a certain amount of pushback from people because I got my feet in the sink. But you know, I'm a little wiser today than I was then. But these are things that people, you know, in order to pray, you have to go through the ablution. In order to have your prayer, you know, to be accepted, that you have to, you know, say and certain things and do it at the right time. So
If I may, I want to add to, I'm sorry, go ahead. Were you finished? I'm sorry. Yeah, I want to say that the same prayer that for the male is the same prayer for the female. I didn't know if Ashaki wanted to say anything, but in the hospital setting, as you said, the patient may not be able to get to the water. They may not be able to get out of the bed. So there are other options that can be used for the purification. The word in Arabic is tajammum. That's not either here nor there. There's a process where it could be done. We normally would face toward Mecca for prayer, but if the patient is in a situation their bed is not facing toward Mecca, they're still in that setting, in the hospital setting. I think there's an allowance for that difficulty, and if our hearts and our intentions are toward Mecca, toward the focus, I should say. But but for female, Sister Shaki, I'm just going to say anything about females praying in the hospital if they were a patient or not.
Sorry, I was on mute there. So I've had many situations where, in regards to voodoo, for my patients in general, I've brought water to them, as well as some patients actually bring in earth. You know, you're talking about stone and things like that to make voodoo. And I feel that a lot. I feel God does make allowances for us, for those who are ill and still want to and need to pray. So there are always different options. And so if the patient requests something from me in regards to their religion, as long as it doesn't harm them or put me in a situation where I am harmed or injured or someone else is injured, there should be no reason why I can't do that for them. So yeah, so that's in regards to the females, we're talking about, well, people in general, but females, the privacy and having female caregivers for them so that they can have that privacy to pray as well as taking care of themselves also. So.
Mm-hmm.
Thank you so much. We have a couple related questions coming across our chat box. One of our clinicians is asking if a patient is unable to wash their own feet, can they wash the patient's feet with a cloth or something? How would that best work?
So I just wanted to add something probably that will help in answering the question. In Islam, there is a rule or a maxim in jurisprudence that says, if the thing is hard to apply, automatically the easier option will apply. So the alternative will kick in automatically. Like Imam Mikhail Sahir was saying, normally we face the east toward Mecca. In the case of hospital setting, if they cannot face the Qibla or the direction of Mecca or east, they actually can pray looking any direction. And the reason why I'm saying this, sometimes as nurses or healthcare professional, not only you could teach the patients, how to take care of themselves and treat them, but you can teach them even about their own religion, by doing this, because, this is an opportunity for you. Probably many Muslims have not heard these issues because these are really advanced level of Islam. Many Muslims, they know the basics. So the reason why we're sharing this, and I'm hoping that we will be able to share certain most important things that you could probably use as a ground to make decisions for Muslims, because sometimes we have to make decisions for them. So if you are a nurse or you are a physician or taking care of a Muslim, and they insist that they wanted to face the east, and that probably is not feasible, or they wanted to use water and water could be harmful actually for them. Then automatically you tell them, no, you cannot use water, you can use rock. So instead, and the rock part is honestly, I heard, I don't know which hospital was it, but there was an individual who told me, a Muslim patient who was asking for a rock for a week, and he didn't get it because people did not understand what he meant by that. So rock is just any small piece of rock that you bring, and then instead of making ablution, washing, we don't get into washing feet and all that. We can avoid all that by making tayammum, which is an alternative for the ablution. So they will just hit the rock twice, and then they pass over their face and their hands. So they really don't have to. Always Islam gives the flexibility part. So and the same thing, for genders, we always prefer the same gender treat the or deal with the patient. This is almost impossible in America. If you go to probably Saudi Arabia, that's the case. Now in this situation, we tell people that no, we can change the hospital system because of this. In fact, the religion actually would make you accept whatever system you find in place. Of course, there are cultural issues, and this is exactly where things get really tough. So if you have a patient from Saudi Arabia, it's very difficult sometimes for a male doctor to deal with a female. And even the doctors feeling uncomfortable many times because of this gender separation. This is culture, is not in Islam. So I'm hoping that if we are encountered with this kind of situation, you are able to tell that Islam actually, we attended a conference or a seminar or workshop, and Islam actually does give us permission to treat you in case of absence of the same gender professional.
Thank you. We have a question related to prayer. One of our chaplains, who is a Jewish rabbi, shares that he asks all his patients if he can pray with them. He wondered if that was something that should be avoided with a Muslim patient.
No.
I think it would depend. It really would depend. The big challenge, and just to go right to the point, is that we are very strong on the monotheistic point of view, and there's not much room. If anything, Muslims are tight and stingy on that's it. We don't have much room on that. The concern would be if someone is praying, and I do a lot of interfaith with the Jewish rabbis, and we both cringe is, are they going to end the prayer in the name of a specific deity that we cannot adhere to? So when you go to pray with someone and you don't fully understand the religion, and someone say in the name of Jesus, which is a very common one, for the Muslim, we on that point there, we may not say anything. On that point there, we blank out. We don't say amen or nothing. So that's the challenge. It would be, or if you ask the patient to lead the prayer, maybe then, because then it would be done according to their religion. But for someone outside the religion to initiate or to say the prayer, it can be difficult. It can be very difficult. I don't know any of the man want to share on that.
I wanted to add to there. Just like the Imam Mikhail and also Imam Ismail mentioned, there is a ritual prayer that we perform 5 times a day. Then there is a prayer which is invoking God or asking God. So if we're talking about the ritual prayer, the expectation there is no expectation from anyone actually to join these 5 prayers because it is not part of their faith. But if it comes to invoking God, asking Him, seeking protection and so forth, we do this all the time. But in this situation, we only invoke God Father in Christianity or God the Creator. We don't invoke anyone because of the monotheism that Imam Mikhail mentioned. So if it is just the prayer is asking God to heal them, to watch over them or so, then it's fine for them actually to join. But if it is the ritual prayers, that is not an expectation.
Mhm. And I guess they also say, are they asking, can I pray for you? Or are they saying, can I pray with you? Or, as I said before, that the patient needs the prayer, that would probably be the safest, if it's going to be just the invoking of God's mercy and presence. And then that way, I think that could be safe probably across all religions, not just Islam.
So I'd like to ask a general question as we continue on with our conversation. When we think about healthcare, are there specific viewpoints that Muslims have concerning particularly Western healthcare that we need to be aware of when Muslim patients come into the hospital that would perhaps impact or affect healthcare as it is viewed and as it is practiced? Could you speak to us about that?
That's a good, excellent question, because you're starting to get a very diverse answers from the Muslim community as far as the religion itself. It has placed no barriers on our receiving whatever kind of treatment that it would be effective. Well, however, you're going to run into individuals who are, anti-vaccine people. You're going to just with the regular general population, it's going to be. I don't think that it would be any higher. I remember that there was a study done in the United States and in one of the African countries, I think it was in Sudan, where they were asked which kind of, medical attention they would prefer. Would they prefer the so-called traditional medicine, or would they, the Western medical? And in the United States, there was a higher rate of, and these are non-Muslims, there was a higher rate of people in America who asked for traditional medicine than in, I think it was the Sudan. So I would say basically, and I'm sure everyone could speak more that there's quite a number of Western trained Muslim doctors in the American medical system. And, as a having trust, that there would be a certain amount of trust level that helps, as they see the doctors, Dr. Abdul or Dr. Whatever his name may be. So, I think that there would be not I don't think there's very much of a difference as far as acceptance of treatment. Go ahead,
I would
somebody.
agree. I'm sorry. Yeah, I would agree with you. There's not much of a difference. The only difference would be that if a particular medication, say for instance, like if there was a medication that had pork, like some type of medication that had pork, Muslim would not want that particular medication. But if it was the only thing that was going to help them, yes, they would accept it, because again, in our religion, God makes it easier for us in the sense that if it's something that's going to keep us alive or keep us in good health, and that is the only thing that is available, then we have to accept whatever. We have to accept it, because it is available. But in general, I don't find much of anything that is out there in the Western medical society that is the issue with the healthcare of
Captain Taylor, I'd like to ask, does that also include not just medicine, but maybe also dress and modesty, to where someone of a Western value may, we are accustomed to a certain level of modesty, and with the wide variety of cultural expressions in Islam, someone may not be sensitive to the patient who came from a culture that's very strict, compared to someone, a Muslim in the next room, who came from a society that was not as strict. And would that be how can that be addressed for the concerns of modesty? Does that include what you just asked us about Western versus other?
Certainly, I think as we are continuing on with this conversation, there's just many different levels that we need to understand as we're looking at Muslim patients, treating Muslim patients, me having patients who are Muslim, trying to understand them, trying to understand the culture. And that was distinguished a little bit earlier, that there's a diversity of culture within the Muslim community, but this trying to get at what are the concerns, particularly with Muslims. And you mentioned about the modesty, and I really appreciate that. I remember not too long ago that as I was walking down the one of the patient units and saw on the door male, there was a prohibition for providers. And there was certainly a welcoming of female providers only. And certainly without that kind of communication for it to be put on the door, then obviously whoever would be on service at that point would have actually gone into the room. And so just small little nuances will help us to understand how best to respect and honor our Muslim brothers and sisters.
I thank you, Chaplain, actually, for mentioning that part. I think sometimes it's important, to refer them to imams, because if there is no female, who can take care of them, right? They wouldn't allow a man to be there. So I think these are the cultural part that we need to work together to create awareness about, right? Yes, I know the hospital wants to respect the culture, but it's impossible to cater every culture, and that is why I will try my best to summarize. I know I don't have half an hour, but there are a few aspects that based on my recommendation, being in hospitals in Saudi Arabia and in certain parts of Africa. If we can get these few things, handled, I think we should be in good shape. And these are the things. The first thing we talked about, which is the prayer and purification. The second is dietary. The diet is very simple in Islam. If it is kosher, it is okay to eat in Islam. If it is vegetables, it is okay to eat. Uh, Honestly, my personal views, which I really think it's a strong point of view in Islamic jurisprudence, it doesn't have to be kosher as long as it's not pork. People are allowed to eat, as long as it is slaughtered by a Christian or Jews, which is the situation in America. So it is permissible for Muslims to eat any type of meat as long as it's not pork. So as long as chicken or beef or so, if it is slaughtered in America or in a Western country that is predominantly Christian or Jews. The medication part, honestly, I know Sister Rodriguez mentioned that Islam does actually, so pork is forbidden, but consuming the actual pork is forbidden. But once the element is transformed, even if it is taken from pork, but it is transformed to a different material, it is no longer, the ruling of prohibition does not apply anymore, which is in Arabic, it is called istihala. So in medication, we have a lot of medication that contain drugs, it can contain, which is forbidden in Islam, can contain, probably elements that are not acceptable in Islam. But if the actual element doesn't exist in the medication, the ruling of prohibition does not apply. The other thing is, we mentioned the modesty and the separation between genders. Islam is very serious in separating between genders and respecting privacy of one another, but there are always exceptions, and especially in medical environment. So, for instance, women, when you get in an area where there are women, they actually expect you to cover their hair before stranger men can actually enter. So allowing them to cover their head, this is part of the religion, but not allowing men to enter the room, it is not religion, not rather it is probably a culture. And the other thing, yes, we do prefer, men in specifically like during childbirth or so. We definitely recommend the same gender in that kind of situations. And as simple as asking permission or knocking before you get in so that they can be prepared, if there is a woman to cover themselves. But a female doctor or nurse does not have to go through a lot of this versus a male doctor or nurse who's serving a female. So the focus a lot is on females covering and modesty in the religion. The last part is end of care. So if we can help, Muslim patients during end of life care, it will be amazing. And most of the time, I really don't want to put a lot of burden on the chaplains because, there are things that we say, there are supplications that we read. The easiest way is to let a doctor, an imam know that, hey, we have a patient who's nearing their life, and I personally am available to help with that. Last but not least, choosing between keeping the life support or not when the doctor determined that this person does not have any chance to live. In Islamic jurisprudence, the prominent school of thought is that if the doctors decide that the person actually can no longer live, without this life support, actually the family should actually remove now at the end the family could choose to do or not, but the Islamic opinion is that actually it is permissible at that end to stop the life support. So I'm thinking that if we can focus on these things, I think we'll render great service, and definitely appreciate you.
I just want to talk a little bit about the male caregiver. I hear what you're saying. So in a situation where we have patients, not necessarily just Muslims, there are women who prefer, the word is prefer, a male caregiver. In that situation, the hospital should and do provide male caregivers, female caregivers. And therefore, did I say it right? Yes, female caregivers. So therefore, if the situation calls for it and we do have the staff to do that, yes, we will provide female caregivers. Now, if we do not have that, then yes, we will have to do what we have to do. But to make all our patients feel comfortable, not just Muslim, male or female, but to make all patients feel comfortable, if they prefer a certain kind of nurse, male or female, it is their right to do that. And it is our right to either provide it, or if we don't have it, don't provide it. So I'm not saying that not give them a female caregiver, but if it is possible, then we go ahead and do that. Give that person that female caregiver. Now, again, with any other situation in regards to dietary and in regards to knocking on the door, you do that for any patient. A patient has a dietary need, you provide that dietary need. The patient needs privacy, you knock on the door before you walk in. These are things that you do every day for all your patients. So that is not necessarily a change. It's just that you be mindful of that in general of all your patients. Uh, just be mindful of having their privacy and their dietary needs and what they need in their patient care. So, yes.
I guess one thing I'll add to that is that in case of if an emergency happens and a male and female may have to enter into their room,
Yeah.
if there's a specialist, the only specialist around that can do this special need for this patient, is not the gender they prefer, but those are extenuating circumstances. And I think Islam is very flexible in allowing that to happen for that time, for that purpose, but not routinely. But there are emergencies They are specialists, and we have to be very flexible. As Muslims, be very flexible on those terms.
And I just wanted to advise actually one thing, Jazakallah khair, Imam, for actually mentioning that. I want you know, to actually watch for signs of abuse. Unfortunately, we had a situation where a family from a Muslim country, the wife didn't speak any English. She was a cancer patient, and they eventually found out that, you know, he was abusive husband, and he actually was risking the life of his wife, where he was so traditional, not Islamic. He was so traditional that he wouldn't allow the wife actually to get the treatment she needs to get, and she was a cancer patient. So my advice to you is, you know, watch for these signs when. I don't know if you have independent translator for patients or not, but sometimes family translation is just, you know, not 100% reliable. The other thing, you know, there are families who individuals who refuse certain type of medication, not because they don't like the medication, but they feel like this is the end of their life, so why they should take treatment. There was a cancer patient who was a stage 2, and she would refuse to take her medication because she's going to die. So in this situation, the faith is very important. Islam does not force anyone to take medication, but Islam make it mandatory for people to do whatever they can to preserve their life. So, you know, talking to an imam or so to convince this patient to take medication, I really think that it does help.
So we did have a patient, this was some time ago, where they were from another country. It might have been Saudi Arabia. The wife would never look at the caregivers.
Yes.
Kept her head down.
Mhm.
And the husband did all of the speaking. You know, do you have pain? He would say no. And she would say nothing. And of course, there was desire on the part of the healthcare team to at least engage, and certainly seeking to understand the cultural dynamics, the religious dynamics, seeking to understand all of that. But there was some concern if there was not abuse.
Yes.
Now, when the husband went away, the wife was now speaking.
Wow. Yeah.
And so there was the desire, if this woman was in any way in danger of her life, how do we provide the support, and also navigating the cultural and or religious dynamics without offending anyone, but also wanting to protect the integrity of our patient and her well-being. So I'm glad we're having these conversations, because sometimes it can be very challenging for us to seek to understand, but also know that there's many dynamics that we just don't quite know.
And unfortunately, Chaplain, you will have to offend someone, because if the person who's abusing is actually there, definitely he has to be held responsible. From particularly, you know, from certain region of the Muslim world, this is honestly is not the norm necessarily, but it is you know, very common. So I always suggest, you know, if you really have to talk an imam to facilitate that conversation, definitely it's a good option. But the point I'm trying to make is, please do not let anyone use the religion or to actually abuse someone or make you convinced that, okay, this is a norm. Islam, there is no way in Islam, nowhere where Islam suppresses anyone. Now, yes, Islam does ask to lower gauges, both for men and women, you know, because of gender separation purpose. That doesn't mean you don't look person in the eye, but it's just the intention is what matters, right? So if you see someone who cannot even speak, that's not Islam. That honestly is abuse and culture many times. So please watch for these signs and let us know, you know, if you are facing someone, and we could tell you, we can give you an emergency answer. Right? This is not a religion, and it probably is not even a culture.
Mhm.
Thank you, that's helpful.
We spoke a little earlier about childbirth and gender preferences. I was curious, more broadly speaking, we know many spiritual traditions include specific beliefs and rituals around the birth of a child. Is this also the case for Muslim families?
For, you saying for childbirth?
Yes, childbirth, care for the child and or the mother right after childbirth. Are there specific practices that our clinicians should be aware of?
Yes, yes, yes. Well, yeah, I'm thinking from two perspectives. I mentioned before, I think I did. I mentioned before that I'm a retired firefighter. So I've had a number more than I can count, probably. The 911 calls for childbirth, and when we got there, the child was coming. You know, the water had broken, and so uh, I think it's the same rule of thumb or rationale in normal conditions. If you can have certain things done according to gender, yes. So with childbirth, the doctor on hand may be a male doctor, and that was true with both. And I was there for the birth of two of my sons, and there was a male doctor there. You know, there was no problem there for me. And I would love for Shaki to speak on because she's a nurse and she take care of patients, so male and female patients. So, what do you do in those situations? I don't think it's a cut and dry, but I'm just going to yield and see what others say on that.
Um, I think so. They actually Islam does highly recommend circumcision for boys, right? Now, for female, no. And honestly, it is done in certain parts of the world, which is called actually genital mutilation. It is not acceptable in Islam, and culturally they do it. So, but for boys, yes, it is actually recommended, highly recommended for them to be circumcised. We had a situation where someone asked me, "Oh, the boy actually has issues in his genital. So should we do circumcision now because we have to do it within 7 days?" I said, first of all, if he has medical issues, the circumcision is not even recommended. It shouldn't be done. Actually, it could be forbidden. That's one thing. The other thing, it shouldn't. It nowhere in Islam it says it has to be done within 7 days. So as long as it is before puberty age, it's fine. The other thing that you might see in Islam, we recommend as soon as the child was born to call for the prayer in his or her ears. So you might see one of the parents will be asking for the child to actually, recite certain stuff in his ear or her ear. That is a normal practice, and it is part of the Islamic actually teachings to read that. Yeah, beside that, I don't see. I think everything is just normal. Definitely, like Sister Rodriguez was saying, if a female doctor would be provided or staff would be provided for birth, definitely that's where a place where we 100% recommend, to insist that we want a female to be there. Uh, but beside that, I don't think of anything else.
When our clinicians are teaching the parents of a Muslim family how to care for their new baby, are there any things they need to be aware of in terms of some of the gender differences that you all have been discussing previously?
No,
No,
there's no difference.
The only thing, I really would, there are a lot of Muslims who do not know, especially immigrants, do not know how to take care of their children. Not necessarily they don't know how to, raise them or not, but the basic things like you're teaching them based on educated and science, way to actually raise your children, take care of your children, feeding them, with milk with measurements and all that. Many of them did not know all of this. So nutrition is a big issue. Of course, the nutrition must be kosher. And I'm not sure. I don't know a lot about baby foods, but I'm sure they are mainly vegan and milk and so forth. Right? So I'm assuming that there is no big issue, but they need a lot of education. And many of them do not know the basic things. But as far as the religion concerned, I don't see any reason, any prohibition or any restrictions.
Yeah,
Thank you.
that education is basic for all patients. So, but in regards to religion, culture, there's no difference.
And we believe that babies are neutral, by the way. They are not Muslims or Christian or anything. They are just where they are.
And I want to ask, has there been any situations that have came up that made you ask that question that you need to be conscious of?
I'm not aware of any situations. I think it was just a question that some of our clinicians had in thinking about some of the issues related to gender roles, if that should influence early childhood care or discussion or working with parents around early childhood care.
Okay. I'd like to go back. You're welcome. I'd like to go back to a question I saw come up before. One of your clinicians were asking, do the nurse or the doctor wash the feet of the Muslim for prayer? And I wanted to come back to that because I think it would be, if the patient cannot wash their feet, they can do the dry washing, the tayammum. I think the washing for prayer is up to the person who's going to be praying, not for someone to wash for them. So someone did ask that question before.
And just adding to the prayer, when somebody's praying, the expectation is for them not to speak or do anything beside the prayer. So you might see someone who's praying and you start talking to them, but they will not get back if they don't reply. That means they are in the prayer status and they should not be engaging in any conversation while they're doing so, which takes about 5 minutes or so.
You're welcome to step out. I'm sorry.
Go ahead.
I'll just say you're welcome to step out or step back and wait till they're done. Like the imam said, it only takes a few minutes for the prayer to be over and you continue to engage, unless it's an emergent situation where you need that care immediately.
Yes. Yeah.
I think we should add to that, if we can. A nurse may not have the freedom to say, "Oh, they're saying prayer." The patient may be in need of medical need. So how do we distinguish? How would a nurse walk into a room distinguish someone who's praying for someone who is going through difficulties? How would they know? They don't have 5 minutes sometimes to come back in 5 minutes. It'd be too late.
Right. So there's different situations. I've come in a room where a person is praying, even if it's not a Muslim, a person who is Christian, who is enthralled in prayer. Again, so I make a judgment by speaking to them. Most times the person they'll look up at you and look back down, like, and then you go, "Oh, you're praying," or you see their lips moving, they're mumbling their prayer. But you kind of make a common sense or a judgment in regards to that. And you can stand there for a moment to make sure they're okay. And if you watching them and you feel like something is wrong, then you address it. If not, you can stand there and wait till they're done. Is that what you're saying?
Yeah, yes. I just said we have to. Yes, yes. There has to be a way until you know the Muslim prayer. You're Muslim yourself, so or you're a person who's sensitive to prayer, so you can make it a judgment, really.
Right.
I just said just to be careful, some kind of way to make sure the patient is saying prayer and not in need of medical care.
If they're praying with the motions, hand motions, then that they're okay. They're not, comatose or anything like that, because there's some motion going on. So therefore, I think any layman would know that this person is not comatose and they're not dead because they're sitting there silently praying. But the silent prayer can be for anyone, being Christian or Muslim. So what does a nurse do for a person who's in silent prayer? Again, for me, I stand and wait, and I make sure that they're breathing and they seem to be okay. If I find in my judgment that there is something else going on, then I will address that. Now, granted, the person who is in prayer, if I'm stopping them from their prayer, they'll come out and oh, I was praying or something like that. That would be a person who is alert and oriented would do. A person who is not alert and oriented would not come out of their prayer and tell me that. They will just be out of it. Do you understand?
Yeah.
Yeah.
We have a follow-up from our clinician who cares for young children. She writes that she cares for children with acquired disabilities and wonders if there are specific views on disability in the Muslim tradition. Also wonders in terms of gender roles, if both parents share the burden of caring or if this is primarily something that females do. And thank you for your response.
Share. We share the burden. It's not a burden, actually. I wouldn't say the word burden. We share the pleasure of taking care of our children. That is not, there is no difference in, I would feel in society in regards to caring for a child. Both parents take on that role.
Mhm.
And the other one in regards to a child with disability, same difference. Child with disability, the parents share taking care of that child. You don't want to put more burden on one parent than the other in regards to taking care of a child. But of course, it's never going to be 50-50 in any relationship. But in regards to taking care of any child, be they physically able child or child who is not physically able, we as parents will take care of them. That is our responsibility.
Thank you. And is there any, are there any background around Islam related to children with disabilities or disabilities in general? Or is that something that this tradition doesn't really speak to specifically?
Actually, that leads us to talk about. Let me just. I second Sister Shaki that it's a shared responsibility, and if as a father you don't know how to change the diaper of your child, then you have a problem, right?
You do.
You might see actually some families and some cultures where fathers do absolutely do not know anything about how to take care of their children. It is 100% mom's responsibility, which is predominantly immigrant cultures. And when you go, especially the Middle East and certain parts of Africa, the parents do not know anything. So in that situation, if you are dealing with that family, perhaps it's not even useful to talk to the dad because you are just wasting your time. Uh, Not saying that he's not responsible, but he wouldn't even understand or probably would not be engaged in whatever you're asking them to do. Uh, as far as disability, we believe that disability is a test from Almighty God, and It is reward for the parents who have actually a disabled child. So, which leads us actually to abortion. In Islam, the default ruling in abortion is forbidden. Uh, but sometimes when the child has some sort of I don't know, you call it defects or disabilities before they were born. Is it okay for the family to abort the in Islam? No, they should actually not abort the pregnancy just because they anticipate disability in that child. Because, like I said, when the child is born with disability, it is the parents' responsibility to take care of and accept the will of God. This, which is one of the 6 pillars that we talked about, the faith, accepting the will of God. And not only that they're accepting the will of God, but they will be getting reward for taking care of that child.
So let me share a situation that we had several years ago. We had a mother who literally she had a fetal demise. And so baby was still inside of her that needed to come out. So there was medication given so that she could actually deliver baby. And in having conversation with the family, particularly the dad in this particular situation, the father felt that the baby, I think it was 16 weeks gestation, the baby was not a human being, was not alive, but to coin his phrase, the baby was a piece of meat. And so there was total denial or total acknowledgement that this was not a human life, but it was a piece of meat. And you had 2 cultures clashing. And so you had the culture of the hospital, particularly labor and delivery nurses, who were looking on and saying, my God, how can we see that this baby is a piece of meat when the family was regarding the baby as a piece of meat? So there was no affection there. I might add that for the mother, it seemed like she was internally emoting, but she was trying to maintain her own sense of composure with her family. So can you speak to that?
Mhm.
Oh, wow.
Oh, that's a big one.
Wow.
That's a big one. I guess the first thing I want to do is separate Islam from that thinking. That's the first thing to come to my mind. I think that was just a very insensitive situation. And was the child breathing? Did the child have a heartbeat?
To the best of my knowledge, what the clinicians were saying is that the baby was a fetal demise. So internally, the baby was dead.
Baby was dead. I guess I'll be honest. I'm kind of shocked, a little bit hurt right now on that one. I mean, just for someone to be that insensitive to life, and life in Islam is very sacred, very important. So I'm gonna let someone else answer that one because I'm not feeling very good about that response.
First of all, um, after 40 days in Islam, it is the body, the baby, after is it called conception? After conception, between the eggs and the sperm, at that moment, actually, we consider them the beginning of human life. And from that point on, they they are sacred. We can never call yes, we are flesh and bones, but you can never call a human being just a piece of meat. That is, I echo Imam Mikhail that that is insensitive and humane, not definitely Islamic. Now, you would even at that time, are we allowed to bury the baby, or should we bury the baby, or should we dispose the baby without burial? Actually, Islam makes it mandatory to bury the baby as if the adult person. So this is how Islam regard to whether it's fetal or it's grown up. We have to do the rituals, bury them with dignity. So I was called actually one time in a hospital in my capacity as a police chaplain to actually mediate between the hospital and the family member who. The family, they're I think Catholic. They were Catholic. The hospital believed that is this should be discarded. I don't know if that's a norm or not. Discarded because it was like maybe a couple of weeks or so. The baby, the fetus. So the family claimed that the hospital wouldn't give them the baby, and the family said, no, we need to have the baby and we need to bury them. And it wasn't actually at that time a human or anything, right? The hospital ended up by giving the family the baby. Right? It was in a container, very small. You can barely see it. So in Islam, even at that stage, we consider them. We have to give them the dignity that they deserve as a human being, and that's where, as a chaplain, William, I really think that it's important. I'm not telling you what to do, but it's very important to correct their views, right? Do not label Islam that way. Do not label human that way. Honestly,
Right.
yeah.
We have a couple of follow-up questions regarding abortion. There's a question as to what Islam might say in a situation where the mother's life is in danger, or in a situation where the pregnancy is the result of rape or incest. Would anyone like to take those questions?
My understanding, that would be very much a question for the husband and wife. And I think the wife would get the edge in that situation. But there may be situations where the mother to be could lose her life. And that's a family a question that really takes a lot of deep thought within the family. I don't think that I know of a clear-cut rule that says yes or no. We have to recognize the conscious. The individual has a conscience. We have to recognize that and respect that the patient has a conscience and they have an intellect, and they should make that decision according to their situation at their need. There's no cookie cutter answer for that each time. That's my understanding of that. But I think the mother would get the real say so in those situations because they're very difficult.
I think this has been discussed by the Jurisprudence Council, the International Jurisprudence Council. In that situation, what we do, we prioritize the health of the mother first, because there is a rule in Islam that says committing lesser of the two harm is not an option, is mandatory. So if the mom's life is at risk, definitely we prioritize we prioritize the life of the mother over the life of the baby. And just like Imam Mikhail said, of course, the decision has to be made, joint decision has to be made between the mom and the dad of the baby. But Islam does prioritize the life of the mom. In case of rape, abortion before 40 days in Islam is acceptable. So before 40 days, because there is actually nothing, obviously. I'm not saying nothing, but not human seed. In Islam, we believe that human begins from 40 and up, 40 days and up. So in case of rape, I would always, definitely, or incest, I always recommend our sisters to run to the hospital, try to either stop the pregnancy, even if they couldn't do it immediately. If they do it before 40 days, yes, it is acceptable. After 40 days, and the restriction will start. After 4 months, it is absolutely not allowed to actually do abortion, because unless the life of the mom is at risk. So before 40 days, it is accepted unconditionally. After 40 days to 4 months, if there is a potential risk like rape or incest or so, then actually abortion is permissible. After 4 months, it is not permissible unless the life of the mom is at risk.
Yeah, two
Thank
points.
you.
That's your head. Oh.
If I can jump in here, hold up. I got to do something. Okay, if I could jump in here, I was thinking about this man saying this is piece of meat, and of course that sounds awful, but it sounds awful, and maybe he is cold like that, maybe it's cold, but a lot of times these are language barriers. These are he's trying to translate from his language, or from another language into English, and he may not know exactly the correct way to put it. For instance, that as Imam Ahmed said, that the Quran describes upon conception as a clot, and then it becomes something that clings to the womb. It clings, and then it becomes the third stage. It becomes something that is almost like, maybe this is what he's referring to. It's just a piece of meat, but that's the wrong description. So a lot of times that if we can try to be, especially when people are coming from other cultures and other languages, that we can be sensitive to the fact that their skill in English may not be up to par, that would allow them to express themselves in the proper way.
Well, you can see the challenges that we're faced with is, I know there was reference to an immigrant family from other nations, And if the husband perhaps does not understand healthcare, does not know how to take care of their baby, then we are wanting, or at least our approach is to be sensitive to all cultures and try to honor the mother and try to honor the father, both as equal, even though there might be inequalities in some cultures. But oftentimes we are still in a quandary of how best do we approach. When we look at all the facts, we try to approach in a way that is honorable and respectful for all.
Yes.
You know, go ahead, Imam.
No, I was going to say something on a different topic, so you go ahead first.
I think I really appreciated for even putting this effort. Like I said earlier, I have been in several hospitals in different countries. Uh, what I see in America is exceptionally amazing. Trying to cater to the culture of people, religion of people, in order to get to this aha moment. I think prioritizing things is very important. um, First comes religion, uh, then after that traditions. uh, but even within the religion now, who would you, if you are torn between a mom and a dad, who actually should have more responsibility, or I mean, who would have the upper hand when it comes to child? Actually, in Islam, the mom would have actually the upper hand. The mom would have to make actually the major decisions when it comes to the health of the baby, because she has automatically the custody of the child in case of divorce or so, until the child gets to age of 7. So that's why when they asked the prophet one time, who deserved my kindness most, this he said, your mom, your mom, your mom, 3 times. So mothers are prioritized in that situation. Not saying that dad doesn't have an opinion, but when you have to choose one or the other, definitely the mother would have. And sometimes mom do not know the right decision, father do not know the right decision. And in that situation, or what is best for their child, or what is best for them. That's why I really think the healthy channel connect, I mean, communication channels between the hospital and the Muslim community is very important. The imams or the messages, because this actually, it is ongoing work. It is a process. As a chaplain, the expectation is not from you, to know every tenet in Islam or trying to remember them, right? But we want it to be a support element for you to make, to help you to make the decision, or for Muslim family.
Yeah, I wanted to raise a point. We had a recent call. I think I think you were involved as well. I think that it was involving a mental situation. And so, what is Islam's position on mental health for as medication as well? Because there are some Muslims, I guess the most faith, in this case with Islam, that they are totally against medication. That they believe in other procedures. And so that's various as well. I don't think there's a one answer, but I think it would help maybe some of your clinicians. We had a general discussion as to some basics when it comes to mental health and mental care. And also another one, I don't know how much time we got left, but the end of life decisions as well. I think those are important because most end of life decisions happen within the hospital setting. So I don't know how much time we got left, but I think those are very important topics.
Yeah, we have a half an hour, and these end of life issues are really very important. Is advanced care planning something that would be appropriate to conduct with a Muslim patient?
Can you explain more? What is advanced care? I'm sorry.
Yeah, advanced care planning. So that would be thinking ahead with that patient about the kind of care they would like to receive or not like to receive toward the end of their life.
Definitely, definitely. And matter of fact, I think there is a obligation, and it's something an obligation when you can do that, to not leave that as a burden upon your family or upon the hospitals. whenever that is possible, to have the will. I think it's called a living will. I think it's called, to where you can say what you want to done and what you do not want to do. I don't know if Sister Shaki ever been close before because she worked within the hospital field, but I think that's very important.
Yeah,
Are there kinds
I
of
agree with
care? Oh, I'm sorry, she could go ahead.
No, it's okay. I was just agreeing with him. It's extremely important to know what, again, I know we're talking about Muslims, but our patients in general, what they would like, especially if you can plan ahead of time, things will go a lot smoother for the patient as well as for the family and as well as for the hospital and staff if we know what you want and what you need.
Yeah. Oh, go ahead. No, I cannot stop you this time, man. Go ahead.
I'm just curious, are there any specific kinds of care or treatment at the end of life that would not be allowed in the Islamic faith?
So to me, honestly, I think whatever you have to do to make them comfortable, let it be. Because morphine, for instance, right? It is considered to be opioid, and opioid is not allowed in Islam. But if that is how we can keep them comfortable toward and I've been asked this a lot, or they said our loved one will get morphine, and I tell them no. If they have to get morphine, let them get it because that's how they can make the pain lesser on the patient instead of struggling before the death. So anything that you could do to make them feel comfortable, definitely it's Islamic. The other thing, the conversation about end of life, it's so ironic that to find that the Christians in America in general, whether Jews or Christian, they are a lot more comfortable to talk about end of life care than many Muslim cultures, even though Islam actually does promote thinking about death on daily basis and being prepared for it. So this is where culture and religion do clash. So, for instance, if you have a family from overseas, they don't even want you to tell them that, oh, they have X amount of days left for them or X amount of month left for them. They don't want to hear that. So, but recently we started a Muslim Islamic aspect of hospice care, where we try to work with hospice care agencies to actually smoothen the explanation of the transition and start working on their funeral. Islam does actually recommend, first of all, even talking about the detail of your funeral. Islam does ask to actually have a living will where your assets will be managed. So it's a difficult conversation culturally, but it is highly recommended conversation Islamically. So what specific things to discuss? Of course, their funeral arrangement, talking to their family members, and we ask people during that time to start asking forgiveness from people. Excel your relationship with them, strengthen your relationship with God, and preparing for your last journey, and so forth. So that's where the role of chaplain actually would be very important in easing the conversation. And I will be more than willing to work with Imam Mikhail during these kind of situations.
I'd like to
Go ahead.
thanks, one of the issues of excuse me would be with the convert Muslim, the Muslim who has converted to Islam, and most of the time, generally, he has a mixed family, meaning that there will be more than just Christian. I mean, there will be more than just Muslims in his family. Maybe it's family members, Christian or Jews or Jewish or whatever, and that sometimes at the end of life, if that has not been taken care of by the person, that of his end of life wishes are not taken care of, that it can create a problem where say that the family is married religiously and they're not married through the state of Indiana, for instance. That would mean that the wife or husband of the Muslim who does not have that marriage license family, that his family who would not be Muslim could take control of his body and take control of his assets, and could possibly not bury him. And this has happened on many occasions, that they would not be buried in as a Muslim, but just buried in a regular way. So that is very important, especially even I'm saying even more so for that convert family, the person who comes from the converted family, that those things are taken care of. And as a chaplain, that conversation is something that you have to have with people, because of a lot of families completely fall apart upon the death of a family member, and that taking precautions beforehand and making the wishes known and the like can resolve a lot of very serious problems.
Yes, thank you, Brother Ismail, because we have seen in the life decisions after the person has passed, the family who was non-Muslim stepped in and even cremated their loved one. And cremation for us is a big no-no. But so having that advance will or the advance notice will be very important for that reason as well. And also, we bury our loved ones. We would love to bury them within 24 hours, but most times it's 48 hours. 72 hours has happened, but you really kind of getting them, because we typically, as conditions require, do not embalm. So having it known through the hospitals as speedy as possible to release the body to the family or to the funeral home would be very important as well. And the last thought on in the life, while the deceased is still alive, and now we have cell phones, we can do it. Softly play the Quran in the background. You can put the Quran on. You have other ways of doing it where they can just, even if they may tend to be in a coma, I've heard this before, that they still can hear. So having the Quran playing, you don't have to be loud at all. Just softly playing in the background would be very important.
I want to go back up just a little bit to comfort care. And then someone asked comfort care versus extended care. Comfort care is not extending the care, it's giving the patient comfort. Like the Imam was talking about, the morphine and things to that extent, is giving the patient comfort. So that is not extending this patient's life, it's making the patient comfortable so they can pass on the life.
Mm-hmm.
We have a couple of questions related to an individual once they have passed away. Is organ donation or tissue donation allowed? And then also, are there any other rituals or preferences for how the body would be handled prior to going to the funeral home? Thank you.
Yes. Go ahead, buddy, ma'am. I see you smiling.
Yeah.
You're on mute.
I'm going to let you do the talk, okay?
Now, the three of us, the imams here, we had a very extensive talk with Indiana donor. With the Indiana donor, we had some lengthy discussions. They changed personnel and we kind of didn't continue it. But organ donation is allowed. We always, I guess the caveat would be, there is individual consciousness and preference. The person may not do that, but there's nothing that we have seen to where it is un-Islamic. As a matter of fact, you can maybe argue that it is Islamic because the value of life supersedes in many situations. So organ donation, I think, is more widely respected in Islam than not.
Just like Imam Mikhail said, we would love to actually, donate to those who are alive to stay alive, because the life of those who are alive is prioritized over the dead people. But the only concerns we have, and I think Imam Mikhail actually beautifully raised these concerns that I didn't know about them before. First, the time that it takes before they process the organ donation, and also what organs can we be selective in, which organs can we donate or not, because we handle our own bodies, so we don't let the funeral home wash the body. We do the bathing and the clothing and the shrouding and everything. So if the body is mutilated and brought to us, it's going to be extremely difficult, if it's not impossible, to actually do it that way. So we have the issues. Islam does recommend and promote organ donation. We believe so, but it's just how we can make it more humane and easy on us as we prepare the body of the deceased. As far as the funeral, what should we do? The death. So immediately after the death, we actually try to loosen the joint of the deceased, so that it doesn't, what you call, I don't know what the term they use.
Rigor mortis.
I'm sorry.
Rigor mortis.
I would never be able to say that. So you hear me.
Okay.
uh,
Yeah.
we try to loosen the joints, and then after that, straighten them and close their eyes, of course, and then covering them. Changing, if they were wearing diapers or so, changing the diapers is really recommended, because when we get to the funeral home, we do our own. uh, we don't have to do any cleanups, because we will do that once they get there, except for changing the diaper. um, then getting a funeral home. I can comfortably say more than 90% of Muslim community, they do not know what is an access tape. So that is why, the role of the chaplain. Sorry, William, I'm kept getting you busier and busier, but the role of the chaplain, the chaplain working with the imam is very important. Be having the numbers of the imams. Hey, there is X person died, and can you help with the? As imams, we are happily. I'm sorry to speak on your behalf, Imam Mikhail and Ismail, because I know you guys do it. We would be happily to be able to stand by the family and help them with the funeral process. So normally we do have selected funeral homes that we prefer. For instance, recently, at least for the Masjid al-Fajr community, we have been going to Sproul Funeral Home, because they actually, cater the Muslim needs more than any other funeral home that I have dealt with. So getting them as soon as possible instead of taking them to the morgue, it's very important. The other thing, covering their private parts, they should not be exposed at all, because in Islam, it's not allowed for any stranger to see not necessarily stranger, but anyone who's not your spouse to see your private part. That's why we make sure that part is covered, and the entire body is covered. The meaning they should not be naked. This is what I could say, actually, and then the funeral home will take over from there.
Is there anyone prohibited from
Yeah.
being a part of that process? And the reason why I mentioned that, several years ago, we had a Muslim patient, female patient, who died at Methodist. And one of our chaplains actually was involved with some of the sisters in the wrapping and the purification of the body, and didn't know if that was prohibited, but certainly there was a welcoming from the community of women who invited her to be a part of that. Could you speak to us about other members of the community who are non-Muslim being invited or wanting to participate in that, to show, again, respect for the patient?
I personally don't know, and I would like to hear from Imam Mikhail and Imam Ismail. I personally, of course, when we do the ritual bathing, then of course Muslims do it because it's ritual and act of worship. but the process of cleaning them up and making them presentable, I don't have any reason to not allow not Muslims or people from other faith to be part of it. There is no any restriction, and that's why I thought, of course, we always prefer the same gender to do that. But if the same gender does not exist, then of course, always the opposite gender can be part of it. But this is the only request. But faith part, actually, I was in one of these situations where a female died actually, and the family were like, "Oh, no, no, we can't allow not Muslim to touch the body." I said, "Where does it say that?" Actually, I end up by getting the help from the nurse, and so they had this perception that, oh, if you are not Muslim, you cannot touch the body. There is nothing that says that in Islam. So I would hope that we can correct them once we see anyone who says that. So we get every help we need within the hospital if we did the same gender, preferably.
And
So,
once a person has
we-
died, is there a particular length of time or a time limit in terms of when they need to be buried?
There is a perception that it has to be. This Islam says as soon as possible. That's what the prophet says. But there, at that time, of course, there were no hours or anything. So any hours or days are really arbitrary, because the prophet himself, when he died, peace be upon him and all the prophets, he was buried the next day. He wasn't buried the same night, even though he could have been buried the same. So sometimes logistics do dictate for delay, but there should not be unnecessary delay. I hear recently, and I hear actually that it has to be within 24 hours. Yes, as soon as possible means 24 hours or less, even if it is possible. But what is not acceptable is unnecessary delay.
Yeah, and one of the reasons, because in both cases, there's no embalming. And we had one situation, we waited a little bit too long, and that putrid smell
Yep.
was a factor. And then no one's pleased. The family's not pleased, we're not pleased. So Sister Shaki, I'm sorry, you wanted to say something?
yeah. In regards to cleaning the body, in the hospital when the patient passed away, again, be they Muslim or not, staff is usually in there to clean the body and make the body presentable. In regards to keeping them modest, that is the same case. You keep the patient modest. You clean them. You put the gown on them. You wash them. They're sent to wherever nursing home they want to nurse to whatever morgue they're going to be sent to. Now, if a family member decided that they want to clean the body, or he's their chaplain or something, that would be up to the family. They wanted the chaplain or something in there, but if there was no restriction saying that, no, because if the family wasn't in there and the patient passed away, our staff members would be put in the patient, and they were not Muslim, some were Christian, some were atheists, but they took care to take care of the patient, clean them, and keep them modest. So, but regards to the ritual, yeah, the ritual is for Muslims to take care of the body at that point.
The only other thing I can think of is it's not important because it may not be doable. The person who is in the last moments of dying, for us, Mecca is a very central point. The city of Mecca, we pray face toward Mecca. Even the section in Crown Hill Cemetery and other cemeteries, the right side of the body faces toward Mecca. If possible, only if possible, if the patient right side can face toward Mecca in their last moments. But once again, as we know, in many hospital settings, that's impossible. And somebody asked a question earlier about an interfaith chapel, and we have some interfaith chapels around. I know at Methodist Hospital, if I made the sign that said Qibla, Qibla means Mecca for the direction of Mecca. And we just ask that nothing, no images being in that direction for an interfaith chapel. There's also an interfaith chapel at the airport, at the Indianapolis airport as well. And likewise, where people from various faith traditions use the same prayer room and each can say their prayer. We just ask that no images be in the direction that we will face or the patient will face during prayer. Chaplain Williams, I'm not sure you're familiar with I'm sure you are, the chapel in Memphis Hospital. I'm not, yeah, that I was involved with that with Michael Wilson, Chaplain Michael Wilson years ago.
And my history goes back to that time period, so I am aware.
Okay, good.
Yeah.
All right.
Thank you.
Thank you.
There was a question about using a pain control Yeah, there is no restriction. You can use any pain medication that will help the patient to control the pain.
Email Ahmed, email Ismail. Mental health. Is that a concern about you? I'm not sure it's a concern like you have. But what are there any Islamic restrictions on mental health and also on medication? Because we have a wide variety of opinions on that, I'm sure.
I don't know of any restrictions on
No,
health and
yeah.
education in regards to Islam. Just like any other person who needs help, it is our duty as healthcare professionals to find the best fit for that person. And it is always a trial and error for any person, within Islam, Christian, Jew, or even atheist, on whatever religion, it is to find that person help.
Well, recently we had a situation, I think you may be from Somalia, and she wanted to have like for lack of a better word, exorcist done on her son. This is about a month ago, I think it was. And so there are differences of opinions, and I think it would help if we speak about that. Not so we have a solution for it, but at least to discuss it.
So I think
that's cultural, not religion.
Yeah.
That's what you're getting at? Okay.
so, Islam in Islam, I think just like Christianity, we believe that there are demons, right? But we cannot sit and blame demons and everything that happens to human, right? We have to make sure that they do their share, but at the same time we have to react differently. All solution must be on the table. So I personally, would consider demon the last thing when the person is going through mental health. Uh, a lot of people come to me as an imam asking to perform exorcism, which I don't entertain doing. But we believe that reading Quran on anyone, it could be spiritually soothing, mentally soothing, even would have physical effect, right? Because we believe that these are holy scriptures. But at the same time, what we don't do is putting the medical side apart and focusing only on the spiritual part. When people come to me with that issue, I'm not a mental health professional, but I read a lot about mental health, and I have a lot of people who I actually go to ask them their advice about mental health. Most of the time, the person comes thinking that they have demon or they're possessed with demon. They have mental illness. And my job as an imam is to tell the person you have mental illness, or I suspect that you have mental illness. So let's actually go. I'm going to refer you to mental health professional, get your help. And at the same time, if you want me to read Quran on you or so, I would be more than willing to do that. But most of the time, it is just mental. Islam believes that we, as human beings, we are three entities, made of three entities: mind and body and soul. Uh, Doctors take care of bodies. Minds are mental health professional, and soul are. This is the imam's job, right? So our job is spiritual. We're not here to cure people physically, just like we're not here to cure people mentally. When everybody knows their role, then I think we will be able to work together. It is a problem when the imam think that there is no mental illness, and unfortunately, we have a lot of situations like this where the imam will say, "No, there is no mental illness. You just have a demon, or you have spiritual issues." So, my approach in handling this is both all mental health professional, physician or nurses or healthcare professional and imams work together. Uh, the healthy person is the person who's healthy in all these three aspects, and that's why I really invite the imams to actually work harder to talk more with mental health professionals in order to help our brothers and sisters who are going through mental health. for the lady or for the individual who I think Imam Mikhail brought it, um, the kid clearly has actually physical challenges and has mental illness, and I was able to speak to the family, and they are to a certain degree convinced that they will seek both treatment, medical treatment, and also I told them to just to make them feel comfortable. I would be more than willing to read Quran on them, which is not in a sense of exorcism, but just reading Quran. Hopefully, that would help. So joint solution is always, I think, the go-to approach.
Yeah, but Ismail, how is this handled within the prison system? Is there any connection between the hospital and a person with mental illness and the who's being incarcerated?
There is, and my numbers may or may not be right exactly, but about 15-20% of prisoners are in Indiana are taking psychotropic drugs. There is evaluation at one prison, and there is a mental health unit at another prison. It's a very difficult issue because it is a very difficult issue, and for for people who have those kind of special needs. Having the, I guess that important thing for us to learn and for me to learn is that to understand what you don't know and not try to do something you don't know, and to find out who to refer people to when they have these special needs, and how to have a basic understanding and knowledge in order that you might recognize when a person has these special needs and they're not mentally well. But it is quite challenging, and unfortunately that many people feel as though that if they have some kind of mental distress, that is because they're failing in faith and their faith is weak, and that what they need to do is become more prayerful and more involved, engaged in their religion, and try to cure themselves that way rather than to go to a professional who is, that is his business. As Imam Ahmed says, we're spiritual. We're spiritual. We look for the spiritual cure as Imam. But the psychologists and the like. There was a particular person that I just mentioned him now. He just passed away maybe a month ago or so. His name is Dr. Malik Badri, and he was here in Indianapolis, and he stayed here for in the 70s, and that he was one of the pioneers of the Muslim psychologist. He was, and one of the books that he translated a book from the 9th century of the Common Era by he was a doctor and a psychologist, this person, where he wrote a manual about mental health and mental wellness, and some what you would call cognitive therapy at this time, we would call that. But this is something that is not new to Islam. It's something that has it spoke of for many years, and that again, like that what we don't know, we should be very willing to say we don't know and to direct people into the correct kind of treatment.
Mhm.
I'd like
Thank
to
you
add
so
that
much.
there was
Thank you,
and
William. I
let me
wanted
just-
to alert
let me
that we
just say
only have a
this.
couple minutes left. So we just wanted to make sure we thanked everyone for joining us today so much. This has just been an incredible and very important and informative session. And William is going to close for us and have our last word. So thank you, William.
Mhm.
You know, I just want to thank each of you for being a part of this. And even though we call it a panel, I believe that it's really a community. You're a community of brothers and sisters. And I just thank you that I've been enriched by listening and engaging in this conversation and learning a little bit more about you. One thing that I'm mindful of is that, and we don't do it so much today, but when you go to a good banquet, there's a lot of food that's on the banquet table. And as being creatures of habit, we tend to go to the foods that we know and like. But oftentimes, if it's a real banquet, there's some food down at the other end of the banquet table that we've never tried before. It doesn't look interesting. It's not exciting. But at the banquet table, we're all invited to be a part and to take part of eating everything that's on the banquet table. And at least we've experienced it. And so we today have experienced what it means to be a Muslim from the 5 tenets that you shared with us earlier, beginning with there's only one God, which is Allah. And then you would continue to have a conversation about childbirth. We talked about end of life. We talked about care of patients. We talked about a number of different things that are certainly important. But one thing that I believe that we have all touched upon today is that whether we be Muslims, whether we be Protestants, whether we be Jewish, is that we all desire simple dignity and self-respect.
Mm-hmm.
I believe today that we've moved just a little bit forward in simple dignity and self-respect in learning more about our brothers and sisters. So I just want to thank you on behalf of IU Health, our chaplaincy department, in partnership with the Evans Center. It's been a joy for us to be together. Michael, I mentioned that I would love to get together with you and break bread, and that's not exclusive to you, but it's also inclusive of each of you. So we look forward to having additional conversation in the future. So blessings be upon you.
Yeah, so thank you. Thanks
Yes.
for.
And I thank you also.
Thank you.
Yeah, thank you.
Yes.
I really enjoyed it. Now, this is recorded, right? You can come and share it again later on, or it's going to be available later on? Okay.
Yeah, this has been recorded and will be posted on the Evans Center website, and potentially for additional CME credit in the future. I'm not sure. Lori and I are working on that, but it will absolutely be posted.
And do you know if all of the contact information will be made available as well? Because there was a question in the chat earlier about each of the panelists.
If it is acceptable to our panelists, we can make that information available.
Yes.
Okay.
So we can email you all separately and just get the sense of whether you would like us to share your contact information or not.
Okay. No problem.
Okay. All right. Thank you all so much. Have a wonderful afternoon. We really appreciate it.
Thank you.
Too. Bye-bye.
Bye.
Yeah.